What if I told you there was an injectable that doesn't just fill, it actually teaches your body to produce collagen? Let's do a deep dive on Sculptra. Hi, my name is Brooke Carrero. I'm a registered nurse in the Philadelphia area, and I hate talking about myself, but here we go. Let's do a deep dive on Sculptra. All right, so let's start off with what is Sculptra? Everybody always comes in and they're like, what's Sculptra? Can I get it? Am I a candidate? In simple terms, Sculptra is technically a filler, but it's a filler not like HA, hyaluronic acid, which most people understand is what a filler is. It is a filler in a sense that it stimulates your body to produce its own collagen. So Sculptra is PLLA, which is polylactic acid. Big long word, which is why I just like to say Sculptra. And when it's injected, this product actually stimulates your body to produce its own collagen. So in simple terms, that it's injected, that naturally allows your skin to kind of thicken, right? And once we get into our 20s, we start to lose that collagen. Skin starts to sag, you're able to pull your face all the way out to the side. Not something that we like because that ages us. So this allows your skin to kind of thicken in a natural way. There's multiple ways to fill the face, essentially. When you're thinking HA filler, hyaluronic acid, it's that immediate result. You get your lips done, you see it. You get your cheeks done, you see it. Sculptra, I always say good things take time. Sculptra is injected, you will essentially see a result. It will kind of reabsorb into the face. And then over the next 6 to 12 weeks, your body starts to naturally produce that collagen. So it's all about the expectations that you have around these treatments. If you're someone that wants things now, probably gonna want some HA. If you're someone that can understand the good things take time, Sculptra is a good route. All right, so now you're asking me, okay, well, what does Sculptra do and am I a good candidate for it? So it's all about expectations with these treatments. Let's think about a patient that was on Ozempic. They lost a ton of weight, ton of volume. They kind of look like Skeletor a little bit because they went too far, and there's no volume to their face. Is Sculptra or filler going to be the right treatment plan for them? Well, first it depends on how much volume loss, because if you have a lot of volume loss, let's think 80%, we're real sunken in, looking like that skeleton, honestly, Sculptra is not going to do it for you. Will it help? Yes, it'll help. But if you're trying to get to that, let's just say baby face, that volume back, it's not going to be enough. So you're going to need a combination of bio-stimulator and HA. Now, if you're that patient, let's use me as an example, that has had filler in their face, I lost a little bit of weight, and now I'm kind of looking to naturally restore my face without adding filler. Sculptra is a great option. They always say 1 vial per decade of life. So it's about 3 if I've never had any, but I probably will do about 1 to 2 vials per year. And again, just to keep that collagen kind of thick in certain areas where I lose volume. So temples, which I'm way overdue for. Temples is a good area to kind of add a little bit of Sculptra there. Midface cheek, I think is really nice. The submalar area over here, periauricular, really, really nice. Sculptra, biostimulators, think 20, 30% volume loss, where you're just looking for a little bit of boost. And remember, HA isn't going to affect the skin quality. Sculptra will, which is why it's nice. So not only is it thickening the skin, it's actually affecting the quality of your skin as well. How it looks. You almost get this glow afterwards. Where do you use Sculptra? And honestly, it can be used in most places that filler are used. So areas that you don't want to use it in, you definitely don't want to use it in the lips. And I personally would never use it in the under eye, even though I know some people do. Areas that I love Sculptra are subtle areas of volume loss. Again, temple, but when it's a mild temple. If you have a severe temple, which mine's kind of getting there right now, I'm probably going to need some HA up there because I waited too long. But mild temple, think like 20 to 30% volume loss. Sculptra, chef's kiss. Volume loss, I feel like this is an area that people don't look at. They're all looking at everything central, but losing this volume back here, you slowly start to lose it. Your cheekbone gets a little bit more high. You're looking a little gaunt. A little bit of Sculptra back there, beautiful. And honestly, think about it like tacking the face back. If our skin gets thin here, everything comes down. So you really want to kind of strengthen the skin in the back of your face. Think about it as tacking it back. So Sculptra in that area, great. And even a little bit of mid-face cheek, awesome. But if you're someone that's completely scared of filler, that just wants that little bit of volume, this is a great way to go. So with every procedure, there are negatives or cons. And some of the big things that I hear with Sculptra all the time are, is it going to give me nodules? And can I get it with an autoimmune? My answer to that is, yes, you can get that with an autoimmune as long as you're not actively inflamed. Now, the other flip side of that is we probably are all actively inflamed. I mean, listen, we walk outside, we grab our phones, cortisol level rises. Cortisol level is associated with stress. Increased cortisol Increased stress to our body equals increased inflammation. So we all are slightly inflamed. Now, my people that actually have autoimmune disorders, lupus and things like that, I have patients that have these, but when we're injecting them, they're not actively inflamed. So again, always consult your provider, be honest with them about what's going on within your health kind of history, and you can come up with a game plan from there. But in simple things, I would say, yes, it's absolutely okay. Now, nodules is another thing. This all goes back to the provider. There are risks with everything that we do, just like there are risks with filler and lip filler, even with going to the gym and eating too much. Always risk with doing these things. But when we're talking nodules, there's two things that you need to consider. One, it's provider. Are they educated enough to inject Sculptra or this bio-stimulator? Do they know the depth, the plane, and how much to be done? That's one thing with nodules. Second thing is the patient. It's up to you. Are you following the aftercare of the provider? So just like it's my job to deliver a treatment, it is also your job to follow the aftercare. You gotta follow the rules. There's a rule that I give to my patients, 5, 5, 5. You wanna massage 5 minutes, 5 times a day, for 5 days. Do that, no nodule forms. So Sculptra and facelifts, this is another question that I get all the time. Patients come in and they're like, oh, can I get Sculptra with a facelift? Listen, as long as you're not planning a facelift a month after, 6 months after, a year after getting Sculptra, you are okay. I would say the golden rule of thumb for most injectors that work alongside of providers that are performing these facelifts are as long as you're not getting any of these treatments within a year of planning surgery, you're fine. You can't go from 0 to 100. You can't go from nothing to, oh, I want a facelift. There's treatments that bridge in between. This is why we do biostimulators. This is why we do filler to kind of help, honestly, prolong the amount of time that I'm going to have to get a facelift. Like, I'm not trying to get a facelift right now, but I know I'm eventually going to get one. Do you think I'm going to wait and not do anything until I need a facelift? Absolutely not. I'm going to do all of the things. So biostimulators, fillers, facials, anything that I can do to prolong the amount of time that I'm going to need a facelift in. So yes, you can get a facelift done and have Sculptra perform. And if somebody tells you otherwise, honestly, they don't know what they're doing. What you can expect after Sculptra. So how it's injected, it's a lot of fluid, okay? So you're gonna be a little bit swollen, not a lot though, but that fluid is the carrier for the Sculptra. It's just a carrier in order to get it into where it needs to go. Once it does, I always tell patients what you look like now is what you should look like in 6 to 12 weeks, more so towards the 12-week mark. Because if I'm using all this volume, you're gonna look nice and full and you're gonna be like, ooh, this looks great. But then you wake up the next morning and you're like, well, wait, where did it go? So that's where the expectation comes into play of this isn't a filler. Again, filler is immediate results. So when you have filler done, you're gonna look like what you look like, right? And it's going to stay. Sculptra, remember, your body naturally produces collagen. So it doesn't happen overnight, it takes a long time. And the results are minimal results. It's not extreme. So you have to get that out of your head. Little bits of volume is what you can expect over the next 6 to 12 weeks. I always tell patients, and again, I'm taking them as well, but take your photos and you see yourself every day. So it's really hard to notice these changes when they're minimal. Again, think about when you're going to the gym or even losing weight, like losing that little bit of weight, you really don't notice it until you're like, wait, I was like 170 and now I'm 140. Like you don't really see it until you see the number. So it's the same thing with Sculptra, right? Like it's minimal adjustments, it's a little bit of thickening, and sometimes like that little bit of collagen production makes the world of a difference to patients. But if you're someone that wants to see things right away, you're not gonna be happy with what Sculptra can do.